Hi, everyone, and welcome to this webinar. We're just going to let a few more people join. We want the room to fill up before we get going. Everyone is really welcome. It's great to see so many of you tuning in today for this really important subject. Hundreds of you joining. And yeah, while we're just waiting for the room to fill up, please do say hi in the chat. Tell us where you work, your union, any experience you might have of the subject. We always like to hear. Okay, I'm going to get going with a bit of webinar housekeeping. Welcome to today's webinar about toilet inspections, obviously toilet inspections in the workplace or during the working time. So we'll be getting onto the subject in a minute. Many of you will have been on one of these webinars before. Please use the chat panel on the right-hand side to tell us a bit about your workplace, any experience you've got of dealing with toilets at work or talking to management about toilets at work. We like to know what's going on in workplaces. We have three amazing speakers who you can see with me on screen. We will be getting onto them in a bit more detail in a second, but we've got Shelly, Ray and Julie. We will be putting some questions to them after the main bit of the webinar. So do post any questions you might have in the Q&A panel, which is at the bottom of the video stream below us. We do, of course, have captions on this webinar. If you'd like to use them, click the show captions button again at the bottom of the screen, and you'll be able to follow along with those. We are, of course, recording today as we usually do. So if you miss anything or you need to drop out for any reason, don't worry, because we'll send you a link to the recording along with any resources that we have that we might mention. We'll send those to you either later today or early tomorrow morning. Right, on to today's subject, which is about toilets at work. And I'm going to let my colleague Shelly Asquith, who is our Health and Safety Officer here at the TUC, to go into a bit of detail about what we mean by that and why this is so important. So, Shelly, over to you.
Thanks, Anna. It's great to be back on the show. Hi, everybody. Thanks for tuning in this afternoon. So I wanted to talk to you first about the problems based on what you told us. Then I'm going to talk to you a little bit about what the regulations say, i.e. what your rights are when it comes to toilets and welfare facilities in the workplace, and then what we're encouraging reps to do in order to improve our workplaces. So back in November, we ran a survey which more than 4,000 of you filled in. We asked you about your experiences of toilets at work. So I'm going to talk to you about those results. These are just some of the headlines, and you can find a thorough report on our website. 57% of union members told us they do not always have the chance to go to the toilet when they need to. 45% do not always have access to a toilet at all. A quarter of respondents are usually say that toilets are usually or always unclean, poorly functioning, or even unusable. Only 18% said that they've got sanitary items provided in their work toilets, so pads and tampons. And then we've got workers reporting health concerns, urinary tract infections, dehydration, stress, because they're thinking about when can I next get to the toilet. Workers said they're using things like bags, buckets, bottles, and bushes as toilet alternatives. And we've got women who report menstrual leakage, wearing incontinence protection, and so on. So while we've got a lot of workers telling us that they are very based in an office, they've got a desk, they can get up from their desk and go to the toilet whenever they want to, more than 10% can only go before or after work finishes or between a shift. And when it comes to breaks, while most usually feel they've got the chance to go, more than 20% told us that altogether they either don't usually get to go when they need on their breaks, or there simply aren't any breaks, or there simply aren't any toilets. We had, for example, teachers telling us they avoid drinking water because they can't get to the toilet between lessons. There's always a long queue during a toilet break. We had warehouse workers saying they wear continence pads because the pressure to pick at speed means they fear punishment from bosses if they go and use their toilet break. And there's 2% of those who responded say that they have no toilet to speak of. That's largely made up of your truck drivers, trades workers, purely mobile workers with not even a depot, so to speak. Workers also commented on the lack of public toilets available in the community and on trains. And I know that Ray and Julie are going to talk more about that. But just to give you one example, a local government worker said, I work alone in remote areas. I've got very limited access to toilet facilities. We rely on public toilets being open, but many of these have been closed by councils. And this sort of thing is often leading to those workers making their own arrangements. And I do at this point just want to share with you some images that union members sent us as part of this survey. I haven't got a slideshow, but I have got my phone here because so many workers told us that they're having to use bushes, buckets, bottles when they're out on a job and there are no toilets to use. A postal worker said, this is a photo of my toilet. It comes to work with me in my rucksack. An emergency plumber said, my toilet is a B&Q bucket, a blue roll, cold stored water and hand soap in the back of my van. I try to save number twos for being near a big supermarket that has toilets, but nature doesn't always allow it. It's disgusting, but that is the reality. Another worker said, it's more difficult to pee outside when the trees and bushes drop their leaves in winter. So people are actually thinking about this as a seasonal problem. Many workers report urinary tract infections from holding it in or dehydration from not drinking, so there's not having that need to urinate. A firefighter even said that he'd gone into a burning building to use the toilet because there was no welfare facilities provided on the site of an incident. And on cleanliness and general facilities, only 23% of this said that this was consistent. Most could usually rely on their toilets to be of a decent standard, but a lot of workers are using disgusting toilets, to put it plainly. A telephone engineer said, well, that's a photo of me and my boyfriend, don't want that. Said, notice the urine ingrained on the floor in the urinals. Management say there's no money to upgrade our toilets. And here's what we're working with. So there's legislation and regulations covering our right to access toilets and welfare facilities when we're in a fixed workplace. So remember, these are a legal minimum. They're not a target, but often employers see them as such. So we've got the Health and Safety at Work Act says your employer must provide a safe and healthy working environment. Access to a clean and functioning toilet is absolutely part of that environment. Now, this is a law we should perhaps be referring to when we've got workers who are out in the field, because just because they're not in a fixed workplace doesn't mean an employer should have to wash their hands, pardon the pun, of their duty to protect you from health risks. But it's the workplace health, safety and welfare regulations that are the most relevant when it comes to that fixed workplace. And you've got the supplementary HSE, Health and Safety Executive Code of Practice, that goes alongside that. So that specifically addresses toilet and washing facilities. It talks about how there must be a suitable number of toilets depending on how big your workforce is. Now, we'll post a link to that in the chat because that goes into quite specific details on this. But just to give you an idea, a workplace with between 1 and 5 employees requires at least 1 toilet, but up to 25, you need 2 toilets, and so on, with an extra toilet for each additional 25 workers. So if you've got 100 people working in your depot but only 1 toilet, your employer's not meeting those regulations. These facilities need to be kept clean, in good condition. You should have reasonable access to them. It talks about your employer being expected to ensure that employers can use these facilities without unnecessary delay. So again, those lack of breaks come in here. And it means that workers should not be denied or restricted accessing the toilet during working hours. The codes, as I say, are quite specific. So it talks about how toilets must also have clean, hot and cold or warm running water, soap or other suitable means of cleaning your hands and lower arms, towels or other suitable means of drying, adequate ventilation and lighting, so you're not washing your hands in the dark, doing your business without good ventilation, separate facilities for men and women, except where each toilet is in a separate room that's lockable from the inside. Sanitary waste disposal must be provided in women's facilities. Toilet paper should be provided in a holder or a dispenser, not just left lying around on the floor. A coat hook should also be provided. And it also goes into detail about what should be expected with regards to disabled toilets as well. Now, I just want to finish by talking you through some of the ideas for organising around this. That there's some detail in this in our report and our write-up of the survey, but just to give you a flavour of what safety reps could be doing to organise around this and make this a campaigning issue in workplaces. So obviously considering your risk assessments, toilets should already be on workplace risk assessments, but are there specific risk assessments required for certain colleagues? For example, those with a disability who might need different access arrangements. Are employers meeting their duty to carry out additional risk assessments for pregnancy as well? Conducting surveys, gathering evidence, getting feedback from your members on toilet conditions, on access, breaks, are they getting enough? These sorts of evidence gathering exercises can highlight what the issues are, create a really compelling case to take to management. Documenting incidents, so encouraging your members to document where they were unable to access toilets when they needed them or found them in unsanitary conditions, taking photos, logging accidents in the accident book if they have an accident, raising the issue at your health and safety committee, so keeping it on the agenda until these problems are resolved. And if you don't have a health and safety committee in your workplace, get one set up. A safety rep has got the right to sit on it. Knowing and referencing those legal standards that I referred to and the regulations, telling your employers where they're not meeting them. Pointing out that poor toilet access and hygiene can lead to those occupational health problems that we know about, the digestive issues, the UTIs, the stress that it causes your members. Also, things like dehydration can cause drowsiness, and not being able to get to the toilet can affect workers' concentration. That can be a real health and safety risk in a safety critical job, which I'm sure Julie will talk about for her members. Workplace petitions, group actions, doing things like all-together breaks where workers take toilet breaks simultaneously can highlight the importance of adequate restroom time without singling out any one particular worker. You can use things like your union newsletters, your social media. You could set up a testimonial wall in common areas, or even do a digital version where workers can anonymously share stories of their experiences. Again, making that visible, making that hard for management to ignore. You can even print some of those experiences onto loo rolls directly, like the one I know Anna's got there, with workers' experiences on each square of your loo roll. So when management next go to the toilet, they know exactly what you guys are going through. You can involve the wider community, so particularly in settings like hospitals or schools, train stations, shops, you can engage the broader community of patients, parents, customers and passenger groups, because these issues often affect them as well, of course. You can demand comprehensive facility assessments by your employer, promoting reporting mechanisms, making sure that you're monitoring your employer's response times to go and fixing things and checking things out. You can also file formal complaints. Now, union health and safety reps can make direct contact with the HSE concerning any legal breaches of regulations. You can use turepconcerns@hse.gov.uk. I'll post that in the chat in a moment. I know one rep who did this and got their employer fined thousands of pounds for inadequate toilet facilities. So it can have impact to go to the regulator as well. And you can do things like coordinated inspections. So if you've got multiple safety reps in your workplace, perhaps from different unions even, could you get together and all carry out coordinated inspections within a week, reporting those results back to your employer, but also to the wider union membership to make sure your members know exactly what's going on and they feel engaged in that campaign. And that leads me just to what we're encouraging people to do through TEC education. We're asking safety reps across the movement to next week carry out inspections on a national scale, carry out a toilet inspection for your members, for your workplace. If you sign up to carry out that toilet inspection, and that could be an inspection of the actual physical facilities, or it could be an inspection of the toilet breaks, how long people are going without access, what issues they're facing if they can't get to the toilet. We will send you all the materials you need. We've got checklists, we've got guides on doing inspections and all the rest of it. You'll get a TUC education credential for taking part as well. And I know that we often think about strike action as often being about pay, but toilets are absolutely an issue that workers are escalating to industrial action over as well. So just to give you a final bit of inspiration, in October, tram workers in Edinburgh won a dispute over toilet breaks after threatening to go on strike. And earlier this year, 12,000 call centre workers for Apple, Google, Microsoft and Netflix went on strike over a lack of toilet breaks. Perhaps it will be your workplace next. Thanks, Anna. Back to you.
Thanks, Shelley, for that really great intro to the subject, or not just intro, loads of really helpful detail. The report on the survey that we did last year is really interesting, if not horrifying reading at times. Some of the pictures that Shelley shared on her phone are just, the tip of the iceberg, really. So we put the link in the chat and we'll send that out to you. So do have a read of that. I've also just put the link in to sign up for Inspections Week, where we'll make sure you get sent all the checklists and the information that Shelley talked about. We already have nearly 700 people signed up to take part in next week's inspection. Inspection of toilets in their workplace, and we love to get more. So please do sign up, share it with other reps. Those of you who do sign up, we will be sending you another link to report your inspection to us next week, and we'll send you TUC verification for doing that, to show that you've done that, that you've reported it, and that you're taking this forward and doing something about it in your workplace. More about Inspections Week in a minute. Next, I'm handing over to Raymond Martin from the British Toilet Association, and he's going to tell us about a campaign that he's working on to try and make improvements to this across the country. So, Raymond, over to you.
Thank you very much indeed, Anna. Good afternoon, everyone, and thank you for having me along today. The British Toilet Association, very briefly, started off in 1999. We're 25 years in this year, and we've been lobbying, campaigning, and fighting on behalf of public toilets and access to toilets for that length of time. Mainly because the government up to this point has taken no particular stance on it. We have the workplace regulations, we have the Public Health Act and the Health and Safety at Work Act or whatever sort of stuff, but that really comes down to employers as opposed to any government taking any control of this. Public toilets does actually, what happened back in 2000 was the Audit Commission pulled away from keeping any records on toilets, and the BTA came into an operation to try and look at public toilets, because we believe they're not about waste management, which is what they've always been treated as. Toilets are about health and well-being, social inclusion, they're about equality, they're about public dignity and public decency. And so we've been driving a campaign forward throughout the last 20 odd years to try and get more public toilets in more public places. Unfortunately, it's actually gone the other way, because back in 2011, the government reduced all the council budgets by 20%. And therefore, we've seen actually a really sharp decline in the last 10 years or so of the number of public toilets out and about, particularly for mobile workers. I know it applies into healthcare workers and emergency service workers, delivery people. But we've seen a massive drop in the number of public toilets out there. Fortunately, it's come back since COVID, and COVID arrived back in 2019, whatever. It caused an emergency response from government, and they suddenly realized that actually we needed places where people can go, wash their hands, stop things like transmission of disease, stop anxiety and stress. So we've actually seen a bit of an upturn now. And actually, at this point in time, the government, we invited the BTA back in November. We were invited into Westminster to put the case to the Parliamentary Under Secretary of State, why we needed toilets, where we needed toilets, what they needed to be, what condition, how do we grade them, how do we make sure they're hygienically clean and whatever. But how do we make sure they're widespread enough? So what we've actually called upon government to do is to appoint an actual person, be it a toilet commissioner or a toilet czar, whatever name they want to put on it, someone who is going to be responsible for looking at toilets up and down the country, both in the public sector and in the private sector as well, through shops and filling stations and superstores and places like town halls, city halls, libraries, museums. But as well as that, on the public side, all the local authorities, what we're asking for is we're asking for a duty to be put on every authority. And there's 450 odd authorities in the UK, another 10,000 parish and town councils, to devise an actual strategy or a plan to plan where they need toilets, in what positions, to help everyone who's visiting or travelling through or moving through that area. That's what we're doing now. We're waiting on the minister. The minister has invited us back in. We're just waiting on a date to go back into there now. But as we came along, we've now launched a Legalise Lose campaign through the media, and it's picking up tremendous support almost on a daily basis from not only organisations and shop owners and local authorities, whatever. We're starting to pick up a lot of traction from MPs and people in positions of government who are saying this is absolutely right. We have to have this. This is about people's well-being. This is about human rights. It's about welfare, and it's about occupational health and safety as well. There is a major lack of toilets now, but one of the problems we're currently facing is, where are the toilets? And particularly with mobile workers, whatever they're saying to us all the time, we don't know where the toilets are. The ones we knew have maybe closed since COVID or haven't reopened again after COVID. So what we're hoping to get from the government is a commission moving forward to start to get all the councils to map the toilets, put them onto some sort of decent system where we know they're open and fit for purpose. But the secondary point to that as well is, if we know where the toilets are, we'll have a gap analysis to know where toilets aren't, and we'll be able to work with local authorities and whatever to bring those in, because it's about access. It's about people having access to toilets. It's about them being able to wash their hands, maybe find fresh water outlets as well. Shelly mentioned a whole range of stuff there, feminine issues, menstruation problems, stomas, colostomy, all those bits and pieces which many of us have to suffer with, and change and find places where they can safely and privately do these things. I know there's a whole range of issues around accessibility and disability, particularly as well. There's issues around unisex toilets as opposed to gender neutral toilets, toilets in schools, and schools. I was just on the radio the other day and on the TV as well, looking at a school up in, I think it was Hull, whereby they're closing all the toilets during the day, and children are now being forced to leave school and go home to use toilets, and then teachers likewise. No, it's not a good idea. So the BTA, we're working on a whole raft of things. We're working with people like the British Standards Institute, because every public toilet has a standard upon it, BS 6465. Every accessible toilet has the standard BS 8300. I sit on those panels, and my colleagues sit on those panels and help to make sure the standards and the infrastructure, the provision, the standard of cleanliness are all kept up. But we really need government to step up to enforce these things. We need them to take control and put this commissioner or minister, whatever it is, in place, someone to audit, someone to help oversee what the problems are, the problems that you guys are feeding back to us. And I'm hoping it'll get more and more, because I'm learning every day. I don't know the answers. I know a lot of smart people who do, but we're learning all the time. The BTA is thirsty to get this information back, to find out what are the problems, to collate those down, to put those to government, to put those to the powers that be, and try and look at this, because it really is it is a human rights thing. As a human species, we have to do 5 things: eat, sleep, drink, breathe, and go to the toilet. And failure to do any one of those 5 things, we as a human species become sick, dizzy, disorientated, can become unconscious. It can lead to high blood pressure, stroke, heart attack, and technically death in any of those 5 instances. So we've had many conversations with people like police, Crime Stoppers, whatever, because drivers driving along the road not being able to access toilets, poisons are building up inside their systems, and they're becoming dizzy, disorientated, and that's a very dangerous situation on our roads and around the country. So we're very much behind everything that you are finding in your areas. We want to learn. We want to hear issues that affecting you, affecting workplace regulations. I'll spend a bit more time on doing some of the stuff on the Health and Safety at Work Act over the next while, sort of stuff. But we're looking to tighten up a lot of stuff, because I think it's been left over the years, because government hasn't taken any issue onto it. It's been sort of left open, and people have been doing their own homework, and not we haven't really tightened up on how this is all going to be accessed. Can I just say one of the things we're actually looking to perhaps introduce a system whereby a shop or business that allows you to use the toilets will be allowed a rate rebate, whereas a shop or whatever who doesn't allow open toilets could maybe find themselves with a rates increase. So those are maybe slightly different ways, their background, things going on. We know that many shops, because of antisocial activity, because of drugs and rough sleeping and various other things, we know a lot of shops and businesses are refusing to let people in. We're hoping to make some changes. We're hoping to make some allowances, as we go forward. All I can say to you is that the BTA totally supports where you are. We're working with British Cleaning Council, British standards. We've got Changing Places, the Changing Places organisation, which I sit on the consortium, the London Loo Alliance. We're working with TfL, we're working with TUC, everybody, because we really have to see a major change in this rights issue and access to public toilets. It is an absolute priority.
Thanks, Ray. It's great to hear about that campaign, about the Toilet Commissioner and all the other work that you've been doing with the British Toilet Association. We're just going to hand over to Julie now before we look at some questions that you've been submitting. So Julie is from ASLEF. So ASLEF is a union for train drivers. So this is obviously from the transport experience. However, because of the nature of train drivers, transportation, it's not a fixed workplace. A lot of the findings from Julie's work will be applicable to lots of different mobile workers, whether they work in transportation or otherwise. So Julie, what can you tell us about the experience of some of your train drivers?
Good afternoon, Anna and Shelly. Thank you for having us. I'm Julie Clegg. Like Anna said, I'm a train driver. I sit on the ASLEF Women's Committee and I've been a train driver for 21 years. I also sit on our subgroup committee for our Dignity for Drivers campaign. Today, I'm going to talk a little bit about that, as it was born from a motion that went to our ASLEF annual conference in 2019. Was put forward by the Women's Committee, originally around the concerns of women's health, with issues like toxic shock syndrome, and basically not being able to use toilet facilities frequently enough. We're basically demanding to see a cross-company recognised health and safety standard of a minimum of 4 hours without access to a toilet. After much research from the Women's Committee, we realised that it was a much bigger issue. And could also involve things like menstruation in general, endometriosis, PCOS, perimenopause, menopause, IBS, DVT, bladder issues, kidney disorders, UTIs, pregnancy, and even some cancers. The list goes on. Some has been mentioned by others already. We basically created the subcommittee and commissioned Unity Consulting in Scotland, who created a report with the survey of the membership. And I'd also like to commend, obviously, the TUC for raising the profile of toilets within the industry. It shows that everything needs pushing through every avenue we can get through. I was also a delegate at the Women's TUC last week, and I seconded a motion on the RMT from this very subject. I'm hopeful that off the back of our research and the hard work that ASLEF has put in, more will come of this for all industries across. In 2022, a train driver exited their cab in basically a siding at West Worthing, believed to be urinating. Unfortunately, he was sadly killed, and unknowingly by another passing train as well. As a result of this, the RAIB did put recommendations and a few measures in place. But from our survey, nearly 70% of drivers said that employers do not provide safe, clean, accessible toilets that they can use throughout their working day. Over 52% expected to work between 4 and 5 hours before they got a suitable break away from the train to use these facilities. As you can see, there's a massive health and safety issue within the industry as a whole. As others have also said, it's a basic human right to have access to safe, clean and appropriate toilets. We've found drivers that are holding onto the urine and bowel movements with only one toilet break in a 10 to 12 hour shift. And sometimes this is up to 6.5 hours at a time. Our human rights are not for sale. They're not an item that we need to buy from employees. This is a health and safety issue. The health and safety executive states all workers have a right to work in places where risks to their health and safety are properly controlled. Health and safety is about stopping you getting hurt at work or ill through your work. Your employer is responsible for your health and safety. The guilty knowledge in our in this report that all employees are now aware of after our launch in Westminster and Holyrood parliamentaries need to be addressed as a matter of urgency. Otherwise, the consequences could be fatal, like we've just heard. Employers have been and are still currently risking the health and safety of their employees. This is a deliberate action of productivity at a cost of their employees' health and safety and has to be stopped now. This could also be a real barrier to engage, especially within the profession. From personal experience and from experience of being a women's rep over the last 12 years, I've had many reports of drivers having to urinate trackside, in bins or bottles because they can't make it to the toilet in time after having to hold themselves for 5 to 6.5 hours. There's been reports of urine-soaked driver's seats, rails on cab doors being destroyed because drivers have had to stand at the cab door at signals to urinate. Women flooding through the sanitary wear or unexpectedly starting their period mid-journey. It can be exceptionally difficult for perimenopausal or women suffering with endometriosis. I've also had knowledge of drivers being diagnosed with chronic kidney disease, more than likely due to holding their urine or bowel movements, according to their doctor's reports. Drivers deliberately dehydrating themselves in work and not eating properly with the fear of constantly needing the toilet is a huge issue. And drivers, as has been said previously, are riddled with anxiety because of this. Being a woman myself and a driver for 21 years, I'm having my kidneys monitored now. I'm on the cusp of chronic kidney disease. I have huge concerns of toxic shock syndrome and not being able to change my sanitary wear regularly, or even not being able to wash my hands with hot soap and water in some places. I have massively heavy periods, which can last up to 7 days, possible endometriosis, and I have to change usually every 3 to 4 hours as a maximum. Rest breaks are really needed in our industry because of the extreme period pain that I, myself, and some other women experience as well. We have known people going as far as putting things like newspapers and plastic bags on drivers' seats, just in the fear of leaking through, and then obviously causing embarrassment to drivers that are coming in the cab after them. We've also a large proportion of drivers in the industry, typically over 45 now, who've made me aware that they can't hold themselves for a long period of time these days. And they also need to stop their mid-train, mid-journey, which causes delays. But then they're subject to questioning afterwards by management. We shouldn't have to get permission to do or go to the toilet. It's human. We need sufficient breaks in our diagrams to put a stop to the embarrassment. I did have a slide of some quotes that have come back from our survey, but I wouldn't have time to go through them all today. But as you can see, in this day and age, it's unacceptable. We're demanding change now, as drivers' health and safety is at risk. It's not acceptable for things like in-cab toilet packs to be issued to drivers, she-wees or period pants. We are human and this behaviour is exploitive. Drivers have enough for being ignored and placed in embarrassing, humiliating or even dangerous situations. It's also illegal if a driver is seen exposing themselves by a member of the public. Our health and safety is being compromised. The ORR and the RSSB should be taking proactive, positive action, not just reactive after like what happened at West Worthing. It's very clear with our research and knowledge cited in our Dignity for Drivers report what the consequences could well be. What we're demanding for, and we need urgent action on, is a maximum period of 4 hours without access to toilet facilities as standard across the industry, the provision of safe, clean, acceptable and dignified toilet and welfare facilities across the network. Drivers must be able to go to the toilet based on their individual and personal needs without being subjected to management interference, discrimination or disciplinary action. We're also demanding that all operators are to provide free sanitary products in the workplace and for them to be available across the network for drivers who wish to use them. I do hope this has been eye-opening for you. Thank you for listening, and I'll pass back to Anna.
It's been absolutely eye-opening, Julie. Really shocking and horrifying to hear at times. I don't know whether you've had a chance to look at the chat as you've been speaking, but people are expressing their horror and solidarity as well. Some are sharing other instances of others who work on trains, perhaps ticket inspectors, and people who work in aviation, which obviously is still transport, with very, there are loos there, but it's obviously very limited in what if something breaks, so they have a different issue. Bus drivers, of course, as well. It's really eye-opening to hear what has been going on in trains specifically. Right, we've had quite a lot of questions come in, and I've been noting a few that have popped up in the chat along the way. We've had quite a few around what the law says and our rights on this. So I'm thinking, Shelley, I might put those to you in the first instance, just if we can give some kind of top level guidance. Even as I'm saying this, it feels mad to say your rights around toilets, because going to the toilet it's so fundamental, isn't it? It shouldn't have a bunch of legislation around it, but here we are. So could you outline what employer obligations are on providing toilets for those with a disability specifically? Where can people find out this information?
Yeah, that's a great question, Anna. They can find out the information. The best place to look for all of this information is the Health and Safety Executive's Code of Practice, which supplements the Welfare Regulations 1992. Now, I know that we've got a link to that in the chat, but that is absolutely a really, really good tool. And it does talk about as much as it talks about what the employer should be providing in terms of toilets and washing facilities and the ratio of toilets to staff and facilities for both men and women. It does also talk about disabled toilets. It also even goes into the details of how big disabled toilets should be, maximum sizes so that they're wheelchair accessible and things like that. So that is the place to look for everything you need. And I think it's actually really well written in terms of being accessible for reps. There's not all that legal jargon, but it does also include lots of references to other links and documents as well. So have a look at that. And if there's anything really specific or anything that's happening in your workplace that you need some more support about, please feel free to get in touch with us or with your union's health and safety lead as well.
Thanks, Shelley. And does that HSE Code of Practice also cover what people's rights are if workplace toilets are broken or have no running water, or is that covered separately?
Well, it talks about the minimum that is supposed to be provided. So if you're experiencing, the minimum is suddenly out of use or it's broken or something like that, then employers need to be providing you with some kind of alternative provision. So it might be that there's another employer down the road that they get an access agreement with so you can use it, or some other kind of workaround. But if it's the case that you actually have no functioning toilets, nothing is clean or working, then they're not meeting the basic legal minimum standards. And I would say you need to have a policy or a toilet policy that says if they can't meet the basic minimum standard of toilet provision, then you're taken off site and you don't have any loss of pay.
Thanks, Shelley. That's really helpful. I'll come back to you in a second, but we've had a question that I think I'll put to Ray. Something he mentioned earlier has come up here. A viewer has asked about, we've all mentioned about the need that women's toilets need sanitary disposal facilities or
Yep.
provision of sanitary products. But there are some men who may need these as well. Perhaps they've had prostate cancer or they have a bowel issue or another medical condition. What would your advice, Ray, be about that for reps in workplaces?
I think the current statistic was showing that 1 in 8 men will contract or suffer with prostate cancer in their lifetime in the UK. So it's a growing number. Prostate Cancer UK launched a campaign with ourselves called Bins for Boys, and the big PHS company is now putting bins all over the country into men's toilets. Now, unlike ladies' toilets where you would have a sanitary bin in every cubicle, what we're doing is putting one bin in one cubicle with a sign to say, if you need to change a pad or whatever, this is here. But again, it's something we want government to bring in as legislation that this has to do. At the moment, it's a voluntary campaign, but it's being picked up everywhere. Well, every Wetherspoons pubs, for example, has a male sanitary bin in one of the cubicles in the toilets. The big airlines are picking it up. We're now starting to see the supermarkets, the Tesco's, Asda, Waitrose, those organisations are starting to pick this up as well. So it's becoming more and more relevant. But yes, men need to change pads. They need to change underwear, sanitary pads, and whatever sort of stuff. Disposable underwear, just the same. But British standards needs to do something, and we're working on this with British standards. At the moment, British standards is only a guideline. It's not legislation. So it's there to show you what you need to do. And we've got things like colostomy shells, coat hooks, bringing cubicle sides down to the floor. We've done a lot, but we need to do more in the way of provision of sanitary products and getting more sanitary products both in the male and female toilets.
Thanks, Ray. That's really helpful. Right, and another question for you, Shelley. Are there any regulations about, so this is now for workers in a fixed workplace. Are there any regulations about the distance that they maybe have to go to the loo? If you're in a really big building, they might be several floors away, the floors might be massive. The viewer in question says that the toilets are 3 floors away from where their staff sit. So is this something that we should be considering as well?
It's definitely something to consider. Unfortunately, the regs are quite vague here, so there's nothing about how specifically far you should be travelling to the toilet, but it does say that that toilets should be readily accessible. They don't specify exact maximum distance, as I say, but the law is clear that workers need to be able to access toilets easily and without unreasonable delay. And what I'd also say is that if you've got workers with specific disabilities, for example, inflammatory bowel disease or things like that, you've also got the Equality Act to consider. So there are reasonable adjustments that should be in place, and certainly nobody with any kind of disease like that should be travelling unreasonable lengths to get to the toilet. But yeah, I mean, it's open to interpretation what unreasonable is, as with lots of things when it comes to health and safety regulation, but expecting people to travel up many flights of stairs or go a long distance without access to a toilet, especially when you remind them what it can be like having a period. Some of these things are often very unexpected. You should be able to get there easily.
Thanks, Shelley. Julie, I wanted to ask you about maybe some of the work you've done within ASLEF. You did this research and report that you told us a lot about the findings of them. Have any of these issues been taken forward by like the reps to the various employers? Someone in the chat mentioned the different train operating companies, and obviously you're not dealing with one employer necessarily, there's a number of them. But have you got any information you can share with us about what happened when you then took it forward?
Yeah, at the minute, this obviously since our conference in 2019, what we originally asked for was reps to go back to their relevant companies and put this in the machinery to be dealt with, because as I've said, every train operating and freight operating company have different terms and conditions, so it can become quite difficult. So we tried that angle first. Every operator is different. Some, have breaks after 5 hours, some are 6 hours, some are 6.5. So we launched this in Parliament. There were various CEOs there of companies, and there was MPs there as well. So as a campaign going forward now, we are lobbying MPs to try and get this dealt with under a Labour government as well. I know I've just noticed a question on there about us becoming Great British Railways and whether Labour will make this better. So hopefully with us campaigning with MPs and CEOs of businesses, this will get better. But if we can get this in as a standard across the whole of the industry, I think that's the way we need to go forward.
Thanks, Julie. That's really helpful to hear what steps you've taken to start the ball rolling with the changes here. Okay, another question we've had is about non-manned sites. Now, I appreciate this is quite specific, but if someone in the course of their work has to visit a non-manned site, perhaps a communications exchange or somewhere that's quite remote, it might only be visited every 2 months by one person, but they take hours to get there, they then do some work, then it may be hours to come back. There's still a problem. Um, have we got any advice about what we could do in those situations? Shelley, do you want to have a go at that one first?
Yeah, I think it might also be one that Ray's got something to say, but I would say that your employer should be carrying out a risk assessment for you as a mobile worker or a lone worker anyway, and your access to a toilet should come into that. So while there might not be a toilet at the place that you're going to, there should be an arrangement for you to access the toilet somewhere along the route, whether it's them partnering with a business or a local service, a local authority, might have buildings along the way where you've got permission to use that toilet, because you as a worker still have a need to go. And it doesn't matter whether there is something, at the end of that or not, the employer's got a duty to protect you from the health risks associated with not being able to go to the toilet for hours on end.
Yeah, absolutely. Did you want to add anything, Ray?
Yeah, one of the things which a lot of people forget is town halls and city halls are all public buildings. They belong to the people. They may be where the mayor works and where the council meets, whatever, but they're actually public buildings. So quite regularly we find up and down the country that people, if you say to them, did you try the town hall? They go, oh, I can't go in there. That's for the council. Those are public buildings, libraries, museums, leisure centres, welcome centres, health and wellbeing centres, and to some degree community centres as well are all places that people could use. Community centres are a little bit difficult because you have children in there, so you have a child issue. But in many cases, there are buildings around the place where people can use. And I agree, travelling to and from these places, if they are that remote, and you really have to sit down. We've had companies write to us and say we have drivers going from Scotland to London. Can you please give us a list of all the toilets on the route? And nobody keeps that information. The government used to keep it many years ago, but don't. That's something which we're hoping that we can step in and fulfill, is to try and map up all these toilets so they could be on your sat nav or they're on your phone. So literally as you're traveling along, you could just press a button on your phone and it would show you the 3 nearest toilets. Wouldn't that be wonderful?
It certainly would. And hopefully the information that you and Shelley just gave about unmanned workplaces can also be useful to the viewer who asked, they're a delivery driver and they obviously visit lots of different places in the course of their work, and they visited farms and were refused access to use the toilet there. I think we're just told to use the side of the field, which isn't acceptable. But the advice you've just given about the unmanned workplace perhaps could also be applied here. There's still an employer who's responsible for that driver's health and safety in the course of their work. We've had quite a few viewers mention, I mean, they're obviously in public facing roles, and within the workplace, the public also access. So that might be a job centre, a museum, some other kind of public facility like that. It's not the same as the town hall, like Raymond was mentioning, but it's a public facing workplace. What would your advice be about, shared toilets that the public would also maybe have access to them? Is this something that is acceptable, or is this something we should be campaigning against? Raymond, do you want to go first with that?
Yeah, and I mean, I think we started off by saying, it's a human rights issue. We need a toilet. Whenever you need to go to the toilet, when poisons are building up inside your system, you have to, expel them, whatever. And all toilets should be open at all times. I think really the only reason at the moment is a cash situation. Councils are not being paid. They're not being funded to have enough facilities. But B, the biggest issue is probably antisocial, where we have a lot of drugs and rough sleepers, whatever, and people are trying to protect and keep those things together. But I don't see any reason why, in any of these places, if you go to doctor's surgeries, you can go into doctor's surgery and use the toilets. There are many other places around the country, as say, you can travel up and down. Pubs are not necessarily the answer. We don't want people flying into the pubs, whatever sort of stuff. But there's no reason why any toilet in any location cannot be used, except if there is obviously an issue with the proprietor.
I'll come in on this, Anna. I think this is a really interesting one because a lot of the time employers leave this to the staff's discretion. So somebody comes into your shop or job centre, I think is the example we've got here, and says, "Can I use your staff toilet?" And you're left to say yes or no. If you say yes, there could be issues of them becoming soiled, as I know somebody's saying here, or if you say no, then that could be a health and safety risk for you because that person could then become agitated. It could be a risk of violence or verbal abuse in the workplace. So I think what employers need to do is have a really clear policy, so that decision is not left on the worker to make at their discretion. Either people are allowed to use the toilet or they're not. Certainly, they've obviously got a responsibility to you as a workforce to make sure that provision is there for you to use and is in adequate kind of condition. So you're the priority. I would also say if there's any other workers, contractors, delivery drivers that are attending your workplace, they should also be allowed to use it. But then you've also got things to consider, like if a disabled person is attending the workplace, or a pregnant woman, or somebody says, I've got XYZ, or I'm menstruating, what is the policy going to be? That should be on the employer, not on you.
Yeah, correct.
Great shout, Shelley. Of course, it's not up to it shouldn't be the individual's responsibility to make these kind of decisions. It should be the employer's. I think we've had time to put, because we've covered a lot, even though I've not asked maybe a specific question from a viewer, but we've managed to cover it in other ways. We have had a question as well about portable loos. If they are on a site, still kept clean and everything within a workplace, is that acceptable? If it's a a permanent workplace, for want of a better description, should portaloos be only used in certain situations?
I think in the construction, it's fairly straightforward all the time, and we're seeing more and more being put out into laybys and whatever in places like the Highlands, around the coastal areas and such. So you're starting to see more portable toilets because obviously they can't. It would cost too much to start running in services and water and electricity and whatever. So it's easy enough to put these portable units up. I think they're acceptable. I think they're far better to have a toilet than not. But if there's a constant need and the need's growing and the need's repeating itself all the time, then I think we really have to look at proper facilities based in the ground and whatever with proper toilets plumbed in.
Yeah, absolutely. They should be providing these. I mean, certain sectors have got their own regulations, like construction design and management regulations covers this, having access to a portaloo if you're on site where it's kind of in permanent basis. If you work in the fire and rescue service or other emergency services, then employers should be putting welfare units in place so that you can use the toilet, you can shower. There are lots of different jobs where these would be needed, but there's an onus on employers to make sure that they're being regularly cleaned and emptied. They need to have separate men and women's portaloos in some circumstances and all the rest of it. So it all still applies. We heard from an archaeologist, a young female archaeologist last week, talking about her experience on a site and the kinds of conditions that portaloos are left in. So it's really important that they're there, but it's really important as well that they're properly maintained.
Yeah.
And final question, again, that a few people have mentioned, is about timed toilet breaks. Now, I'm pretty sure I know what everyone's opinion is going to be, but what advice can we give to people who are in workplaces where toilet breaks are timed? And they might be timed by like a door code lock or something that you have to enter when you go into the loo and you leave the loo. I mean, this isn't something that there's legislation about, but what, from a union perspective, can we do to challenge this? Shelley?
Well, I saw Julie nodding as well there, so she might have something to add.
Yeah, sure.
But I mean, first of all, I talked about how employers cannot unreasonably restrict your toilet access. So if they are giving you very short toilet breaks, or they're timing you, or they're putting pressure on you to not take too long in the toilet, that's a problem. Raise it with your union, organise around this issue. If you've got, certain illnesses and things, then ask for reasonable adjustments and reference the Equality Act as well. But these things need challenging, because not only are they risk to your health and safety physically, but it also causes psychosocial problems like stress in the workplace as well. So really against it. Appreciate that in certain jobs, teaching, for example, there are only that timetable or shift work or when you're driving a train. But yeah, in principle against it, and there needs to be workarounds and definitely get the union on it.
Great.
Julie, did you want to add something on that from the train driver's experience?
I think you basically covered that. I'm probably in agreement with you that it's unacceptable, and it probably can be discriminative as well against people that have got certain disabilities. I think what people need to be doing is working with equality reps, and any reports of anything like this need to go in with the reps, and then they can work with the health and safety reps and try and make it a bit of a bigger project. But yeah, I agree with you, Shelley.
Great stuff, Julie. Thank you. I think probably what we'll round off with now is another reminder of what next week is all about, and Toilet Inspections Week. We started with this, and I'll just sort of summarise it before we finish. We're asking you all as workplace reps to inspect your workplace toilets and facilities next week. We appreciate you might not be able to quite get it done next week. Don't worry, we're always eager to hear what you're doing. So if you do it in the weeks following, don't worry about that. If you sign up to take part, and let me actually check the numbers, it might have gone up in the past hour of the number of you who signed up. It has gone up by nearly 50 over the past hour, so that's great to hear. We will send you all a report form so that you can report your inspection to us, and then we at the TUC will send you recognition that you've done this. We'll also be sharing the results of these of your inspections. Shelly and us and the team here will put that together, so do look out for that. We really also want to hear about what changes that you've been able to make as a result of this inspection, what union action you've taken forward, either with negotiations with your employer or what you've discussed with other reps. Like Julie just said, work with equality reps. Remember, you're not alone on this. This isn't something that you have to do by yourself. You can work with like across the reps team. Equality, obviously, we imagine a lot of you on here are health and safety reps, regular shop stewards. It doesn't matter. You can work together on this issue, because going to the loo really does affect everyone. And it's sort of the universal experience, isn't it? Before we finished, I just want to bring your attention to another event that we're doing here at the TUC on health and safety. It's not about toilets, it's about asbestos. It's on the 28th of April and it's here in London. We've just put the link in the chat, so do take a look and register. Shelley, do you want to give us a bit of a flavour of what that event will be about?
Yes, absolutely. So if you didn't already know, you are more likely to be diagnosed with asbestos cancer in Britain than in any other country in the world. This remains the biggest cause of workplace fatality, work-related fatality. So we are campaigning to remove asbestos from all public buildings. This conference is going to be about upskilling reps, giving you some practical advice and workshops if you're working in a workplace that contains asbestos, but it's also going to be about the wider policy and campaigning work we're doing to convince the government to get rid of it once and for all. So if you're a health and safety rep, please do come to that event. It's on the 28th of April, which is also Workers' Memorial Day. It'd be fantastic to see you there. We'll provide you lunch and drink at the end of the day.
Can't wait to see many of you in person. We will send the recording for this event, this webinar we've just done, either out later today or tomorrow, along with all the resources and links that we've been talking about. Hope to see you all again soon. Bye bye from all of us here, and happy Inspections Week.